So we've been helping people to find Medicare options that fit their budgets, their healthcare needs, and their healthcare goals for basically over a decade at this point. And I have seen a lot of plans come and a lot of plans go. And today I am going to go over the 5 reasons why I would never, ever choose a Medicare Advantage HMO plan. Also, by the way, next week, check out our next video, which is going to be 5 reasons why maybe you should at least consider it. There's pretty good arguments both ways. Now, this is Michael's Medicare, where we talk about all things from Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, if you like these videos, please don't forget to like and subscribe, because it does really help our channel grow, and also because it'll help you stay up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right. Here we go. Let's start off today by talking about what are Medicare Advantage plans, or MAPDs, or Medicare Health Plans, or Medicare Part C plans. Man, they have a lot of really different names. They have more names than Pablo Picasso's real name. Pablo Diego Jose Francisco de Paula Juan Nepomuceno Maria de los Remedios Cipriano de la Santísima Trinidad Ruiz y Picasso. That's his real name. Anyways, they have a lot of names, and the reason that these Medicare Advantage plans exist primarily is because of the shortcomings of Original Medicare. It's because Original Medicare, which is made up of Medicare Part A and Medicare Part B, they got a lot of holes in their coverage. Medicare Part A covers things like hospitalizations, big surgeries, skilled nursing care, and things that fall under that type of big care. That's all Medicare Part A. In the second half, Original Medicare, that is Medicare Part B, covers more day-to-day care. Things like doctor's visits, checkups, x-rays, lab work, specialist visits, and those types of, again, day-to-day care. Additionally, unlike Medicare Part A, for most Americans on Medicare, or as we call them, Medicareans, Medicare Part B has a monthly cost in 2024, which is $174.70. And this cost changes every year, and by changes, I mean it goes up. Medicare Part A covers hospital, Medicare Part B covers doctor's visits, and there you go, right? Bob is your uncle. Like I said, Medicare doesn't cover everything, and it can leave some pretty big coverage gaps for someone who has even a normal healthcare usages. Some of these are by design, and some of these seem like maybe perhaps an oversight, but needless to say, there are a lot. Starting with the fact that there are deductibles for usages under both Medicare Part A and Part B that have to be paid at 100%. Then there are, of course, daily costs that are set, and the fact that for daily types of care under Medicare Part B, the beneficiary is left responsible paying for 20% of those bills without any limit. Meaning without limits, I mean, those bills, they can get pretty expensive. Oh, also, neither of them cover prescription drugs that somebody needs to get from the pharmacy. Now, this is where Medicare Advantage plans come in. They are both private health insurance companies, many of which we all know, and a few that really nobody knows. But they are essentially health insurance plans, mostly HMOs, like someone would have had at work or through a health exchange, but they are only eligible for Medicare beneficiaries who have both Medicare Part A and Medicare Part B, and they help pay for those costs mentioned through an HMO managed care system. So the benefits are they do actually help bring down the expense of being on Medicare by covering those things that are covered on Original Medicare, but also covering those things that oftentimes are not covered under Original Medicare. But those benefits come at a pretty significant cost. So here are 5 reasons why you may not want to consider enrolling into a Medicare Advantage HMO plan. Now, one of the biggest problems for new folks coming into Medicare and trying to weigh out staying on Original Medicare or adding a Medicare supplement or switching everything to a Medicare Advantage HMO plan is the fact that they can be very restrictive on their doctors, specifically because of the HMO nature of the plan. Original Medicare, or Original Medicare with a Medicare supplement plan attached, well, they don't really have any doctors' networks. Pretty much as long as the doctor is willing and able to bill Medicare for their services they provide to the Medicare beneficiary, then someone can go slap down that beautiful red, white, and blue card and utilize those services, and then away they go. But under a Medicare Advantage HMO plan, they are run through a health maintenance organization. That means that the doctors available are organized into a system of networks. In order to go see a primary care doctor or a PCP in the HMO system, someone has to be assigned to that particular doctor through the insurance company. Then, if you need to go see a specialist or get an MRI or go do physical therapy or see a different doctor, that doctor can only send you to those other services that are contracted within the same doctor's network. I mean, really only in the rarest exceptional situations would it be approved to go outside the network because, I mean, honestly, it would cost the insurance company buku bucks. Overall, that means you're sort of stuck with the doctors they have in network, and you can change to another doctor in another network, but usually it's only once a month. So yeah, it can be a bit restrictive to say the least, especially if you want or need a plethora of doctors to be available. To go along with that, sort of hand in hand with the doctors network's limitations that come with a Medicare Advantage HMO plan, probably one of the biggest complaints and drawbacks to HMO Medicare Advantage plans is the simple fact that they are managed care. They are HMOs. They are health maintenance organizations. It is precisely this type of management by the insurance company that causes so much headache. This is because along with only being able to see doctors that are within the prescribed networks, the care that a person can get through an HMO plan is overseen. It is bureaucratized. It is scrutinized down to every last cent. So for example, if a primary care doctor thinks you need to go to a physical therapy 20 times to help recover from a surgery, the insurance company could say, well, they think that only going to need to approve a visit to physical therapy for 10 times. Or if someone says that they want an additional expensive test like an MRI or an EKG or something that size, the plan could only approve less expensive tests first and then only after that pay for those more expensive tests. Or they could deny the test altogether. This is done through an authorization process that is based on partly what somebody's direct doctor approves, but also can be run through a panel of doctors within the insurance company to weigh out the different types of procedures or treatments that are being requested and have a high likelihood of outcome of improving health conditions for a patient versus the cost. Essentially weighing out somebody's health needs, even if their doctor is recommended to them, versus the cost to the insurance company. And sometimes, a lot of times, the decision comes in favor of saving the company money instead of doing the extra test. So not a great position to be in if you think you need more extensive healthcare. That's just kind of part and parcel of an HMO plan. Next up is an issue that comes up for folks who are taking medications and moving on to Medicare. This is simply because Medicare Advantage plans, at least here in Southern California again, usually are automatically paired with Medicare Part D plans. They are referred to as Medicare Advantage Part D plans, or MAPDs, and they are seen as beneficial because usually they do not have deductibles for the Medicare Part D portions, and usually they don't have a monthly cost or premium for the Medicare Part D portion as well, both of which are almost universally present on standalone prescription drug plans. But the downside of having an MA and a PD plan that is connected is that it's hard to get the best of both worlds. What I mean by this is that when you choose an MAPD plan, you also have to take the Part D drug plan that comes along with that Medicare Advantage plan, which probably isn't a big issue for someone who doesn't have any medications when they enroll and then start taking prescriptions afterwards, because the doctor is only going to prescribe prescriptions that are on the drug list or on the formulary. But if someone is coming into Medicare and has a few medications, it could put them in a position where they can choose a Medicare Advantage HMO plan because they like the doctors, but the medications they need are not covered under that prescription drug plan. Or maybe they like a prescription drug plan, but they don't like the doctors within that network. It's not always the case that both fit the needs of the Medicare beneficiary. Whereas if someone has just original Medicare plan and they want to choose from the many standalone PDP plans, prescription drug plans, they can. And they can change them every year to fit their changing needs if their needs change. These last two are pretty straightforward, and the first of which is the simple fact that Medicare Advantage HMO plans have a pretty strong restrictions on where they can be used, meaning that if you are the kind of person who enjoys traveling around the United States, maybe in an RV, or just spend some extended time periods visiting family, the benefits on a Medicare Advantage HMO plan are not really going to be portable. Sure, for emergencies you will always have coverage, but if you want to go see a doctor in Omaha, Nebraska because you're visiting your aunt, you're just going to be out of luck, because that is going to be considered out of network. But even if you live in Los Angeles and you wanted to go to a doctor in another county like San Diego, that too would also be out of network. So you just don't have the same types of travel options that someone would have under original Medicare with a Medicare supplement, where you can basically go anywhere in the United States. Lastly is the stability of Medicare Advantage markets. Now, of course, there are some very big, very stable Medicare Advantage HMO plans, but there also are a lot of newcomers that come in every year and then come into the market, make huge promises to beneficiaries with rich doctors networks, rich benefits, and rich prescription drug coverages. But many of these smaller companies, they get bought up, or they can't can't get enough enrollments to sustain those benefits or have to change substantially to stay competitive and financially sound, and that leads to many of them disappearing year in and year out. For Medicare beneficiaries, that can be a huge pain in the neck if the plan leaves the market because they are stuck having to figure out what other Medicare options are available or have to switch or have to find something else, even if it is in the middle of the year, outside of the annual election period. This, huge headache. All right, so to bring this all together, yes, there are significant drawbacks to deciding to enroll into a Medicare Advantage HMO plan. They have pretty severe limits on doctors, they can limit care, and they can limit where you can go and still get care among a host of other problems. But with all that being said, there are also some pretty big advantages as well. That's why they're called Medicare Advantage. Wagga wagga. No, but really there are some benefits to them, and we are going to discuss those advantages of a Medicare Advantage in the next video. We are looking at whether or not to enroll in a Medicare Advantage plan, or a Medicare Supplement plan, or a Medicare Part D plan for that matter, or whichever, try to figure out whichever one is right for you. Please feel free to give us a call, to drop us a line, or leave us a comment in the box down below, or even check out our other great Medicare content on the socials on YouTube and Instagram, because we have new Medicare content coming out every single week. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.